Studies by Scripps Research say that 45% of all COVID-19 infection cases are asymptomatic, which makes detection difficult and plays an immense role in the ongoing spread of the deadly virus. Well, let's get a little bit more detail about this. And talking to us this morning is Professor Lucille Blumberg. She's the Deputy Director of Epidemiology at the National Institute for Communicable Diseases. Good to have you on the program again, Prof. Thanks for your time.
Yes, good morning.
So this research basically finding that 45% of people who are infected with the coronavirus show absolutely no symptoms, which is great for them because, at least you are well, you're holding yourself up. But the problem is that you may be infecting others. So perhaps you can talk to us about this.
You're absolutely right. And people are walking around with the infection. We have widespread community transmission at the moment. And while many of these asymptomatics will remain well, some may develop symptoms, it's the risk of transmission from them to others in the community, particularly vulnerable groups who are at risk for severe illness, hospitalization, and even death. That is the big concern.
Yeah, it certainly is. But is there anything you should be aware of? I mean, maybe I'm sitting here and I'm positive and I don't even know it because I feel absolutely fine. But a lot of people I speak to that do have coronavirus feel like they did the day before, just perfect. So is there anything that is a telltale sign that you may not be well?
So there are, I think the symptoms are fairly well described. Yeah. They're not specific. They're cough, sore throat, some people have fever, loss of smell, loss of taste seem to be important features. So those would, I think, inform people that they may have corona. The problem is that we can't do, community tests to, as a population, reduce transmission, and everyone needs to take responsibility for this. I mentioned vulnerable groups. These are specific groups of people who are at risk for severe illness. And I think we need to highlight that and what they can do.
Yeah. All right. So you talk about age and anybody with comorbidities. Now, we're going to talk to that in a short while, but let's focus on age. Was any specific age-related research done, given the fact that there is the ongoing debate as to whether schools should be open or not?
So we do have a system that we established at the National Institute for Communicable Diseases. We set it up in March. We started to get excellent data, got a great team called the DATCOV system in April. And we've looked at various things. These are hospitalized patients particularly. And we've shown that age is very important. Being at risk for more severe disease, anyone over 60. I think this has been shown internationally. But very few children have been admitted under the age of 18. And the ones that have been admitted are mostly those with other underlying problems. So I don't think children are the major focus of the severe illness. There have been some cases of this multi-system illness. But for the most part, people and those with underlying illness that really experience the more severe illness, which is really where we need to focus our effort.
Yeah, indeed. But obviously there is the issue, and I think that the findings are quite clear, that children do carry the virus and they do spread it. Even though they may be asymptomatic and perfectly fine, it's the spreading that's the problem to their parents, their grandparents, to their teachers. That surely is an issue.
So children may be infected. They may play a role in transmission, but I think it's a little different to influenza, where children are a major source of infection. I really think it's all people, it's all adults, and not specifically children. I think the previous interview spoke about lots of social, psychological issues in schools. I don't think they are the major focus and should be the major focus for transmission. It's really adults in in our populations.
Yeah. In terms of a bigger threat, and we heard the World Health Organization talking about, warning about schools opening where community transmission is at its peak, and it appears that we're there at the moment. But the other issue that I think a lot of people are worrying about in terms of infection with the economy opening and taxis getting the green light from government to have a 100% loading capacity. Surely these are all things that are a big concern.
So, it's a balance between opening an economy, and we absolutely have to.
Yeah.
I think the economic downfalls of continuing with lockdowns are huge, and I think everyone knows that and experienced that. But I think people are getting the wrong message. As the lockdowns have been released, they think everything is okay. COVID doesn't have a very visible picture out there. And I really think this is the time for everyone to take responsibility for reducing transmission. Yes, taxis are a risk. Opening windows is a reality in this cold climate, but people can do other things to reduce transmission. Mm-hmm. You often hear about these, what they call non-pharmaceutical interventions. Mask wearing absolutely reduces transmission. If you're infected, if you're asymptomatic, you wear a mask and you wear it properly, and you wear it in a taxi, you wear it in a public space. If you are infected, it will considerably reduce your chance of infecting other people. Yeah. But compliance with these is very poor. Despite this being, regulation, people are really not taking responsibility for reducing transmission in communities. Yeah,
and that's something that we heard the president speaking very seriously about, and also, Ronald Lamoura, our minister, also saying that it is now going to basically be a criminal offence if you do not wear a mask. It's been taken up to that level, and I suppose the seriousness of it again, and I'd like to bring some numbers into the equation that we've been told, both the president and our Minister of Cooperative Governance and Traditional Affairs, and Nkosazana Dlamini Zuma, giving us the figures that approximately 500 people are getting infected every single hour here in South Africa. We've seen the 12,000 level drop for the last 2 days. We haven't reported the figure of 12,000, which I hope is a sign of a good sign, but who knows? But given all of the research that's done, are you surprised by these rising figures, or is this what we were looking at all along?
No, this is not unexpected. The lockdown was clearly just to, is really to buy time to get your health facilities ready for the surge. Surges have happened in most countries. And, I think how to deal with it now is, and I've mentioned this before, is everyone taking responsibility for reducing transmission. And that can be done. Yeah. Our hospitals are overwhelmed, particularly in Gauteng, and I think we've seen many stories of what's happened. Okay, so I think we can expect this, but we can do a lot of things to mitigate. Doctors, nurses are doing their level best, and they're doing a sterling job. But everyone must now take responsibility and play their part in reducing transmission and protecting the vulnerable groups, not just the elderly, from contracting COVID because of their risk for hospitalization, severe disease, and death.
Yeah. Prof, last week we saw the World Health Organization saying that there's now evidence that the coronavirus might be airborne. What is the NICD's view on this?
Well, I think the general view is that it is droplet transmission. So those are small droplets with virus expelled when somebody speaks or is in an area from those who are infected. They're not all ill. These droplets with virus they don't spread a long distance. They quite rapidly fall to the ground, and that is the usual. I think aerosolization of these infected droplets can occur under specific circumstances. In hospitals, when certain procedures are undertaken, suctioning of patients, when people, like a group of people like a choir, sing at the top of their voices, you may well get aerosol spread. For the most part, I think the evidence points towards droplet spread and therefore the use of cloth masks for general population, surgical masks for healthcare workers will provide a very good protection.
So now the NICD has said that there is a great misconception about who is more prone to COVID-19 infections. And I know you were getting there at the beginning of the interview, and this is what I want to dedicate a little bit of time to. Please elaborate a bit on this for us.
Yeah. So everybody's at risk. Yeah. Everybody in a household, at a gathering, in a confined space, is at risk if somebody in that group is infected. But there's specific groups who are at risk for severe illness. And through our DATCOF system, our hospital-based system, and we've looked at 20,000 admissions, age is definitely critical in the risk, over 60, and other underlying illnesses. And I would put diabetes at the top of that list. So if you're any age, under 60, over 60, mostly the maturity onset diabetes, the type 2, you're definitely at risk for severe illness. And that's been shown in many parts of the world. It's not exclusive to here. Hypertension, obesity, I think that's not often recognized by people. Any chronic lung disease, kidney disease, immune suppression, people with cancer, people on cancer therapy. HIV seems to have a modestly increased risk, but it's more HIV persons who have other comorbidities. Previous TB would be very similar. But overwhelmingly, diabetes, obesity, hypertension are at the top of the list.
Yeah.
And it's those people we need to protect, those people who we need to follow up very carefully if they do become infected, do have the symptoms of COVID, for early treatment. If they suddenly get increased shortness of breath, oxygen can be life-saving.
Yeah. I want to talk a little bit about your immune system. And there's been a lot of talk of, the issue of herd mentality. And if everybody goes out and gets it, it's probably better because then it's over. And the chances are that the public are, you're going to be immune to it. But from research and from seeing what is happening in other countries that perhaps have already been through what we're going through now, is that there is that reinfection and there is that second wave. And there's been studies and reports coming out that, after 3 months, your system, unfortunately, the antibodies are down again and you can catch coronavirus again. Can you talk to us a little bit about that? What are the findings in reinfection?
So, this is an area that is still being explored. I think there are many components of it that are not clear. It is, I think, likely that reinfection is a possibility, a little bit like influenza, different strains. We haven't seen that yet. So, a number of countries tried this. They just kind of opened up, didn't lock down at all, didn't impose restrictions, and they had a huge COVID numbers and huge and overwhelmed hospitals. So I'm not sure that herd immunity really works. I think we've got lots to learn. Don't have a vaccine yet. I'm not sure that's the right to follow. Because if you are infected, you can infect another person who's much more vulnerable to severe illness. And that's why everybody has to take responsibility for reducing transmission. I don't think it's a good strategy.
In the beginning, this was very much so seen as a respiratory problem and that it would affect your breathing and that would be the biggest problem. However, we're seeing a lot more research coming out, and I know that everything is fluid right now and things are changing at a very, very fast rate. But, from countries like Italy, where they are bringing out studies of now looking at the after effects of people that have been affected by COVID, that there are so many other effects that it's having on different organs, including the brain. I mean, I don't want to go into detail because I am no medical practitioner, but it's research and things that have been brought out. What are the findings of this? Because, you may worry about not catching it, but it's the after effect. And also, I think this might even encourage people to protect themselves even more because you really don't want to suffer the after effects.
So I think it remains predominantly a respiratory disease, and COVID pneumonia, COVID, what we call acute respiratory distress syndrome, is the main feature of acute COVID. And that's why oxygen and different interventions to support ventilation are. So yes, there are other systems involved. We know about coagulation, we know about clots in various parts of the we know about neurological features. So it is essentially a multi-system illness. But in the acute stage, it's predominantly respiratory. There is more and more work coming out on after effects. We hear about COVID lung, fibrosis of the lung, even in otherwise fit people who did suffer severe COVID, who recovered. They still have problems with getting back to where they were with reduced effort tolerance and quite a lot of neurological or depression or chronic fatigue. But overwhelmingly, it is an acute respiratory illness.
Yeah.
And that's why people die from the acute respiratory illness for the main part.
Okay. Let's talk to the numbers that we're seeing here in South Africa in terms of the infection rate. So, we were seeing 12,000 plus a day. We've gone down slightly in the infection levels. But my question still, in terms of the backlog of reporting, how are we doing with those numbers?
So I think you must not be misled by a reduction in numbers over 1 or 2. Testing's changed, and they absolutely needed to change in many areas. The testing, community testing, is not helpful because we know it's widespread, and testing kits and capacity. So we absolutely must focus on those who need urgent diagnosis. So those are hospitalized patients, patients with pneumonia, and healthcare symptoms. There really is no point in doing community testing now. And when that was done on a wide scale, when everyone in the community with respiratory systems was tested, it overwhelmed the system. And there were huge backlogs. People were getting results 14 days after submission. It's not helpful for a community response of identifying infected patients, isolating them, following up contacts and quarantining them to reduce, community transmission. Really, backlogs are still a reality. I think both in the public and private sector, there are some still challenges. And the important thing is to focus on the priority groups for testing.
Okay. Smoking. I have to talk to you about that because, that's been the big thing, the ban on the sale of tobacco. Now, of course, we've seen alcohol also enter into the red zone of don't go there. Do not even think about buying yourself some booze now. But tobacco, this is a very contentious issue in South Africa. I know it's a respiratory problem and the illness, but people are still finding ways to smoke. By not selling cigarettes, it doesn't matter. What is your opinion on this?
So we don't have data on the effect of smoking on COVID. You ask a patient, do you smoke? And, they're in hospital, they're short of breath, they're waiting for oxygen. They will tell you, no, I don't smoke. Or they'll say, I stopped yesterday. That's my experience with smoking questions over many patients. So the data is not going to be good. I think you have to look at what is the effect of smoking on respiratory function, and that is very clear. It is not good for your health. But we know that smokers are finding every way to have access to cigarettes, and there are a lot around. Yeah. So, I think banning of cigarettes has to be seen in that light. They are getting access to cigarettes.
All right, Prof, let's leave it there. You've been really insightful this morning. Professor Lucille Blumberg from the National Institute of Communicable Diseases talking to us about COVID-19 as well as giving us some advice on how to best protect ourselves. That mask is the biggest thing, sanitizing another big thing, especially as more and more South Africans return to work. But how is that? So there's no evidence on smoking and whether it is a bigger factor or not. Yeah, I found that interesting. Let's take a break. We'll see you after this.